Are you unsure whether or not you have ADHD? Well, I have got the self-report scale. This is the piece of paper that you would need to take to your doctors in order to be referred for an assessment. Get yourself a piece of paper now, grab a pen. I need you to do the following. I want you to write 1, 2, 3, 4, 5, 6 across the top. Right, never, rarely, sometimes, often, and very often. I'm going to run through the questions, and for each question, you will need to put a mark on the box that is relevant to you. First question. How often do you have trouble completing the final tasks of a project after overcoming the more challenging aspects? 2. How often do you have difficulty getting things in order when you have to do a task that requires organisation? 3. How often do you have problems remembering appointments or obligations? 4. When you have a task that requires a lot of thought, how often do you avoid or delay getting started? 5. How often do you fidget or squirm with your hands or feet when you have to sit down for a long time? 6. How often do you feel overly active and compelled to do things, like you were driven by motor? That is part A. Part A is the most important part of this assessment. Just going to go through the point scoring system. You need 4 or more marks for you to be referred. Questions 1 to 3, if you have answered sometimes, often, or very often for any one of those questions, then that is 1 point. If you have answered often or very often to questions 4 to 6, that is 1 point. So if you have 4 or more points, then you can take this to your GP and get referred. Go to Clinical Partners Right to Choose webpage. This form is on there. Print it off, fill it in, and take it to your GP. If your GP has never heard of Right to Choose, make sure you show him this and also show him the link that is on the Clinical Partners website, which is Make a Referral.